You're watching World Insight. With a global pandemic, all of us will live in a new normal. However, there's much more challenges than opportunities. Take a look at this chart compiled by the World Economic Forum. From prolonged world recession to restricted global travel and geopolitical exploitation of this crisis, you name it. And we'll have to fight against all of these together, as we are all in this together. For more discussion on the global battle against COVID-19, we are also joined from London, Linda Bold, Bruce and John Usher Professor of Public Health with the University of Edinburgh. Welcome to our program, Linda. Tell me more, Ms. Bold, about the UK's fight now against COVID-19.
So we've been one of the hardest hit countries in the world. Of course, more cases in Brazil, Russia and the US than we have. But in terms of all-cause mortality, the UK has done very badly. But we've had a very hard lockdown of over 10 weeks, and it's now gradually releasing. Our numbers are way down now. Yesterday, we just had several deaths, a very low number, and the number of cases in the UK overall was around 860. So that's a huge decline from recent weeks, but we still have a long way to go.
What do you think, Ms. Bold, that the UK has learned through this hard battle?
I mean, I think we learned a number of things. We were very badly prepared at the beginning. We didn't have the infrastructure that China, South Korea, or other Singapore, other jurisdictions had. We were very poor to get our testing up and running at a suitable level. We didn't have a well-developed contact tracing system. We've always had one, but it was very small. We also were not able to resource the teams, public health teams, that needed to respond. And then we also had to shift people out of our hospitals into nursing homes, where, of course, unfortunately, for our older people, have been badly hit by COVID. So there's so many mistakes that the UK has made. But now I think that our case numbers are so low, and we've learned about testing and contact tracing, and also simple things like wearing face coverings, that we are in a better position. But as we get into the later months of the year, in the influenza season, I think it's going to be very challenging for the UK to keep those numbers as low as possible.
Many believe that we are likely to live in this new normal for years to come. What is your thought? What is this new normal, and how is that related to infectious disease, particularly coronavirus and particularly COVID-19?
I think what people often forget is that we have over 10 million cases of tuberculosis every year globally, and we don't have a vaccine for tuberculosis, but we have effective treatments. So in terms of the months ahead, I think we'll be living with COVID-19, SARS-CoV-2, the virus, well into next year. I don't think we're going to have a vaccine, if we ever have an effective one, until next year. But I'm hopeful for better treatments. So what we need to do, all countries, is keep the case numbers low, keep the physical distancing, the face coverings, keep our health services with additional capacity. And unfortunately, as we've seen in the UK just last night announced, have local lockdowns, very geographically targeted where there are more cases. And we've just applied one in Leicester, in the Midlands of England. Of course, Beijing recently had one, parts of Germany. But if we can keep that response local and not lock down the whole country, that's a much, much better and more sustainable way to do it.
If you look at what's happening around the world, in the United States, it is the largest economy in the world, and the world will not be able to open if the US could not do well. So, Ms. Bold, how pragmatic should we be about the US possibility?
Well, I think the problem in the US and indeed in the UK has been that governments have disinvested in the public health response for so many years, and also the US is a very complex country with many different states. They're not handling it well at all. I think my biggest concern now is not just the virus, it is, as you say, the economic impact of the US being badly hit and so many European and other economies. We're facing a huge recession. So what we need to do is two things. Three things. Continue with the public health response, do the science, but but also recognize that we need governments to step up to provide income and security, benefits to their populations, so that people are not irretrievably harmed. Their economic and mental well-being is not irretrievably harmed by our response to COVID-19, and that's particularly important, finally, of course, for our young people, whose future depends on jobs and education.
Ms. Bold, herd immunity. Those were the terminologies actually very first shared by the British health community with the rest of the world. Of course, some of the opinions were being criticized. But now, when you look at that concept, how far away from there can we allow it to happen without a vaccine? With the U.S., 24 million likely already, according to their health authorities, of confirmed cases. How far are they from there? Will we see a scenario where the U.S. has achieved a herd immunity in a very sad way, while the rest of the world would not? So how do you see those scenarios?
I mean, achieving herd immunity is very unpalatable because it involves many thousands of preventable deaths. Yes. And what we see from serology testing, so blood testing in Europe and indeed elsewhere, is that the level of immunity, from what we understand so far, is still quite low in countries like the UK. Only 5 to 7% of people have developed antibodies in response to the virus. So we are way off that concept. And countries like Sweden, who've embraced more of that, are suffering badly at the moment. So I don't think herd immunity is the solution. We'll only really get herd immunity with a vaccine. So protecting our populations through the measures we've just discussed is really the only viable way forward.
If you look at the mortality rate, it is mainly people with the age 75 and above. You know, for those from 20 to 40, it is only 0.5% of confirmed rate, but for 75 years older, it could be many times of that, likely to reaching almost 20%. So, Ms. Bold, this is Darwinism in a way, but in a civilized society, we have to do something, because the current generation that are in danger, those who are 75 years or older, have been contributing to our society and gave birth to all of us to begin with. They're our family members. So how should, do you think, from a health expert's perspective, balance these two things? One is reality, the other is the things that civil societies need to do.
Yes, I mean, in a perfect world, we would protect the elderly and those with underlying health conditions and keep them away from the rest of society because the risk of COVID-19 to younger people is so small, and that's been called shielding in the UK. But it's ethically and from a human rights perspective not sustainable. We can't cut off our older people from society. So we are dependent on the public health response to get the case numbers so low that it is safer for older people to be out in their communities again, to be seeing their families, and to not have the huge risk of getting the virus and developing COVID-19. So we have to strike a balance between meeting the needs of the young and also protecting the old, but allowing them to interact with society.
Do you think the UK has found a way so far, or in its search to find a way, is there some clues that you can share?
Yeah, so what I would say is we're catching up. We're catching up with other countries, particularly in South Asia, that have responded more rapidly and better than we have.
When we talk to some people, they've been telling us how much they wish life will be the same again. But when we talk to health experts like you, we hear that there's going to be a new normal, and that is going to be the normal. So how should we reconcile the wishes and the realities? Ms. Bold.
I think it's very difficult. I think that if you look at history, we've recovered from global conflicts or regional conflicts, and we have returned to normal life. And hopefully we will have more normalcy in the future. But in the short term, we won't. I think there are good things. We will be doing less traveling, more virtual meetings, more healthcare consultations over the internet rather than in person. All of these things are potential benefits for the environment and our way of life. but also we will suffer in that we won't have the same social interactions, and the economic harms will be very substantial. So we need to get used to living in a new way, and also recognizing that in the future we may see other pandemics. And the key message for me is that all countries need to be prepared, not just for future waves of COVID-19, but also for when this type of thing happens again, so we avoid what I think has been a catastrophic global experience to date.
Linda Bull, the Bruce and John Usher Professor of Public Health from University of Edinburgh. Thank you so much. Be well yourself, okay?
Thank you very much.